Hey, this is Tyler. I'm here with my friend James Wakeley. We're going to do a review of the MyMedic Medic Kit, so stick with me. So a little bit about myself. A lot of people that have seen the channel know who I am. If you haven't, that's fine as well. My medical experience is I was an EMT. I was a soldier for many decades. I've worked with firefighting and law enforcement, and that's kind of the angle that I take. So I'm not going to be as educated on the in the hospital stuff as much as I'm going to be on gunshots, vehicle breakdowns, and that kind of things. So because of that, I brought in James Wakeley, and I'll let him introduce who he is and tell you what he's done.
Hey everybody, I'm James Wakeley. A lot of my medical side background, we have a training company where we train a lot of different disciplines of stuff. And as far as medical goes, a lot of my background is in off-grid, austere medicine, so wilderness first responder, wilderness EMT, and also bridging over into the threat-based medicine, tactical combat casualty care, things like that. So combining those disciplines, and that's where a lot of my passion in my on the medical side is.
Okay, so with that in mind, let's give you a review. I purchased this from mymedic.com a month ago, a couple weeks ago, and my first thoughts on this bag and the first thing that comes to my mind is this looks like the A bag that the Special Forces guys would use. They call it a stomp pouch. There's a couple different names for it, and the thing that I'm personally looking for, and I had the IFAC for MyMedic many years ago. It's amazing because it's all compartmented, meaning if I need Band-Aids, I'm also going to need betadine. I'm also going to need like the Band-Aid related things, and that's in one pouch. If I need airway related stuff, that's in another pouch. If I need bullet hole related stuff, I'm going to need a sucking chest patch. I'm going to need needles to decompress it, and that's in another pouch. So MyMedic really kind of has that down on lock in that they give you the crap I need right now up front, and they create packets or pouches for the different things that you want to do. And while it's in my brain real quick too, I like to label stuff. Like some of it is self-explanatory, like your shears. I don't need to label shears, but I maybe need to label what is in this thing. So I'll take a black Sharpie, and again, this is brand new bag, and I'll put like airway, I'll put bleeding, I'll put BSI, which is body substance isolation, so that when I'm seeing someone on the side of the road with bones sticking out of their limbs, or a bullet wound, or a broken leg, or my kid's injured, I can go, okay, I need this, bleeding, got it. I need airway, got it, got my mask, whatever. So that's kind of what I want in a bag. I know he wants similar things, and he kind of explained both what he wants and what this bag has, which I think is interesting.
Yeah, to echo what Tyler's talked about, when I first broke this bag out, Tyler left this bag with me for about a week, and I played with it, checked it out very thoroughly. First thoughts is the materials and workmanship seemed really, really good. I was impressed. A lot of times as you start outsourcing the container, the bags themselves, overseas and stuff, sometimes we see a quality drop.
You get this really nice contents.
Yeah.
You leave it in your car for a week, and the seams start to rip out and blow apart, and then
UV damage
UV goes through it. Yeah. I've got a kit in my truck right now with that problem.
Yeah, it's a big problem. So I was impressed to see that they did a good job on their container. Good quality elastic loops. A lot of times these are where parts fail in the bag. As far as contents go, a lot of the kits that I see factory produced or assembled and configured on the market, quite a bit underwhelming, but I kind of have pretty high standards. That was not the case with the MyMedic setup. I was very impressed with not just the layout, the way that they have everything configured, the way they have the different panels and stuff. Again, Tyler mentioned that this is based off the predecessor Stomp Pack system, so you have different categories and areas and different places to store and garage things.
Yeah, like as an example, you open it up, what are the first things you always need? Gloves, shears, right? You have to have body substance isolation. Maybe you could even add a mask right here. You a lot of times need to start cutting clothing apart to get to a broken, injured, whatever, see what's actually going on. But you need to throw your gloves on first, right up front. So even on the other kits that I have, and again, I haven't touched this one yet, the first thing I do is throw a couple packets of gloves so that I can open up, immediately hit the gloves, grab the shears, start working on that. And then I have access to bleeding so that I can deal with bleeding really fast.
Yeah, it's become a common parlance and practice from the tactical community moving into EMS, civilian style, for the acronym MARCH. So we deal with massive hemorrhaging, airway, breathing.
And that's a change because it used to be breathing first, but
ABCs,
blood loss
right?
faster. Blood can be lost faster and kill you quicker than oxygen.
Right.
So.
Yep. Circulation, and then head injury and hypothermia is what the H stands for. So, like Tyler was mentioning, the way that they've got this laid out. Another piece that was very enlightening to me is the quality of the actual components. A lot of times you get these kits and you start breaking them open to use either the Band-Aids or prep pads, things like that.
Dried up. The strips you pull off them are crunchy and falling apart, or the Band-Aids are hard plastic instead of something stretchy that you actually want to wear.
Yeah, the Band-Aids fall off, they get wet, they get moist, they just fall off. That's not the case. The Band-Aid quality material that they have in here is exceptionally well. I put one of their Band-Aids on my finger and wore it around for like 3 days just to see how well it would stay. And I was very impressed. Even underwater, it didn't come off. They also have not cut corners with the components that they're choosing for the inners. For example, on their white pads and stuff like that, they're actually using the poly packs, which the reason that's important, a lot of people I don't see talking about this, he's talking about things drying out. Have you ever pulled out one of the alcohol or iodine prep pads or anything, you go to open it and it just dries a bone? It's like the paper with the foil in the back.
It uses osmosis to push the alcohol out of the actual container, and it changes the ratio of liquid to dry components. It'll actually increase.
It just leaches out of the package.
Yeah, it'll increase the dry components and then decrease the liquid components, which changes the delivery mechanism. So it can actually be dangerous with some stuff other than like water and alcohol.
Yeah, and it's the worst when you go to use something in your kit and it's not usable because it's dried out.
Yeah.
So these are poly packs. They kind of like have a shiny. This material, if you see these in first aid kits with the poly packs, they're great because they last really, really well.
And this bag's going to be a trunk bag for me, so that's important for me at least, because I need to be able to make sure that when I need it, maybe a year or two from now, or even next week, it's there, it's available, and I can actually use it. There's nothing worse than, I got my kit, you pull the kit out, nope, sorry, you're going to bleed.
Yeah.
So.
Yeah, good quality Casualty Blankets, and they include 4 of these, which is a good amount, especially to start off with a kit like this to add. They're Casualty Mylar reflective blankets. Those are huge for reducing hypothermia and shock. We use those every time.
Hyperthermia because they can
reflect sun
and make a shade spot. And
we call it a radiant heat barrier for hyperthermia. One thing I've never seen really out of a lot of store-bought kits is you always see the cold packs. You always see those. I've never seen somebody include hot packs, especially for like wilderness. Mm-hmm. This is fantastic for when you have to add heat into the system for somebody with hypothermia because their body ain't generating their own heat.
So I'll go out in the wintertime with this pack. In the future, I plan on going out again in the wintertime, and I'll have heat, and in the summertime, and I'll have cold. So it's nice to know that when I'm teaching a survival class and we're many hours out in the middle of nowhere, and we've been there for 3 or 4 days, nobody's been eating, and something happens, I've got a way to warm somebody up, a way to cool somebody down. And I don't have to rebuild my kit every season. That's not okay. Okay, tell me what we see here and why you think they packed it on the top, and then we'll move to the next pouch.
Okay. Well, one thing, first things first is while I'm pretty happy with most of the layout of where they've positioned everything, there's definitely a lot of stuff I would change. I like to have my immediate stuff in the first panel. So, for example, all the gloves are just in this pouch, right? So I would separate this out, have a few packs of gloves immediately.
It's kind of a personal preference thing.
Right, because I like to go from, like we were talking about with the March protocol, I like to be able to address, massive bleeding first, airway. It doesn't have any airway devices. That's something I would add.
I'm actually going to rob my other kit, and that's something I would add as well. There's a more expensive variation of this this one's called the Medic. There's like the Medic Pro, and it's almost double the price. I didn't buy that one. It does have some of that, but I also intend on adding that again later, which is another thing. It's good to have.
It's a great thing about this kit. Is you can expand it.
And I'm never going to be completely happy with a kit that is from a store built by somebody else.
Yep.
Because I'm pretentious, right? And I assume that you're the same way. There's not going to be something that a store sells that's going to be exactly how you want it. So sometimes it's, if you don't know exactly what you're doing, buy the more expensive kit and then rebuild it. If you have a little education, buy the less expensive kit like I did, and then just add the things that you want to it if you're actually going to do that. So.
Correct. Yep. I couldn't echo that more. So the things that I would add in, dovetail in, are some tourniquets. Obviously, you're not going to get that on a base, on a base to mid-level kit. I would add tourniquets in. Also,
something in the military is we had the tourniquets. We just left them on the outside, so you don't even have to get into the bag because people can bleed out in seconds. So if you've got, we would use rubber bands that you use in parachuting. There's these straps on the back of your parachute that break the rubber bands. So these just little thick, heavy rubber bands that we would attach at least 1 to 4, depending on what type of kit it is, tourniquets to the outside. So you could just grab it, violently yank it out. You don't have to unzip anything. If you're nervous or covered in blood, you don't have to deal with excess. You just get that thing and get it on quick.
So. Right, and to that point, you've got Molly on the front of this bag, so you can add in the thing you want to be careful
Velcro.
with. Yeah, and Velcro. Yeah. The thing you want to be careful with when you're storing tourniquets out in direct sunlight is UV damage. They've come a long way, so we don't get as much of that damage. But you can buy tourniquet pouches that are quick grip. You can also Molly other type of pouches and storage to here, just hook the tourniquets. There's these really cool bungees that you can get that go in between the Molly and then give you 2 bungees to quickly attach tourniquets to the outside of a pack like this as well.
If you're looking for stuff like that, a lot of law enforcement, for whatever reason, you'll see a lot more law enforcement tourniquet pouches. Military, we don't have a lot of tourniquet pouches because you deploy, you just reset them all. So they're going to get replaced. But if you're looking for those pouches, look in law enforcement circles. I assume my medic has some. I don't know. Well, you can check their website out.
Yeah, and Amazon too as well. Yeah, just their wound wash I like. They give you 4 bottles of this wound wash eye wash. So this is a combination saline and rinse. So this does wound irrigation and eye, which is one of the most common things you're going to use saline for.
Yeah, that's something that's really interesting too. Like people will build out these big old amazing kits. I've never used this kit for bullet wounds. I hope I never do. I want the stuff because when I need it, I need it. The reality is there are some things you're going to use on a regular basis. Like in my last kit, I constantly use the triangle-shaped splinter remover.
Yes.
Right. I constantly use the big SpongeBob knee band-aids because if you're bleeding, you actually need a band-aid. You probably need a big one. And eye wash, stuff to get stuff out of your eyes. All of those little minor things you're going to use way more often than the other stuff. So if you have a kit that doesn't have the minor things, it's just like a bleeding kit, that's great. You're probably never going to use your kit. The reality is you want a kit that can do the regular stuff that you're going to see on the regular, in addition to the big stuff that you're not going to see as often or in hopeful instances ever.
With this wound wash, they have also chosen to go with a pressure tip, which is kind of like a sports bottle drink, and you can open this in various heights and actually be able to get some pressure.
It's nice to blast particulates out of your eye. I was riding on the back of a trailer behind a tractor in the middle of the winter in Idaho, and it flicked up some basalt, right? And basalt is this jagged little nasty rock, and I caught one in the eye, and it scratched the whole top of my eye. And I remember having to put a blindfold on my eye, just keep. When the left eye moved, the right eye moved too, and I needed a way to keep it from scratching again and again and again. So something like that would have been super effective to peel back and blast and get those chunks out. Inevitably, I ended up going blindfolded to the doctor, and it took hours just because I didn't have something like this, which is really simple, easy to throw in thing. Now, clearly, you can use a saline wash to clean out cuts and other things, but my mind goes to the time I needed it.
Mm-hmm. Yep. Yeah, that's a nice feature that they've put on there. You can also refill these, so once you're, especially for an austere environment where you don't have resupply and things like that, backcountry, wilderness.
Boil some water and throw it in.
Yeah, you can repurpose these, which is nice.
Okay, so let's check out that second kit. This main kit has body substance isolation, reflective blankets. These are thermostats. These are tweezers, that kind of stuff. Thermometers, tweezers, whistles, heat pack, cold pack. This is hydrogen peroxide for spray cleaning.
The cool thing about this hydrogen peroxide that they've done is a lot of times you'll just get a bottle that's just dripping. They've actually included a spray bottle for this, so being able to spray and mist over a surface to get sterilization.
Yeah, so you're not blasting through it, and you can actually only use what you need.
Right, and the one thing with hydrogen peroxide, just with if any training you've had, always be careful because you don't want to use this in wounds that are below a certain depth. A certain depth, it will cause necrosis inside the wound. But it's really cool that they put a spray top on this guy.
I think it's kind of a top application. So what are these guys right here? What have we got in these packs?
So you've got all your prep stuff so like hand sanitizer, your PPE, so your gloves, all that stuff. Their medicine pouch is let's see, there we go. So they've got a treatment and a relief mod, which is cool because this has antibiotic ointment in it, lip balm, sunscreen, sting relief, hydrocortisone for itching, and then they also have they actually include a tooth gel, like an oral pain relief, which you don't see that in many kits. So that's awesome.
But if you're in the backcountry, there's two things that you really need if your teeth are jacked up. One is a flosser. Two is pain relief until you get home.
Exactly. Let's see what else. Oh, you got burn treatment here. So I like the way that they've set up their burn packs. So you have one large burn dressing in here, and then for all your minor burns and smaller stuff, they have individual burn packets. That way you're not opening up a huge packet of burn gel, only to not use a fraction of the packet and then have to toss the rest.
And one thing I would personally add is there's this stuff called burn free that you can use on sunburns. You can use it on fire burns, on stove burns. I will in the future throw a bottle of that in there, and then burn free makes a big pack that can cover the entire face. Statistically, if you can get to a burn almost immediately with something like this or burn free, you have a substantially higher recovery rate. Less damage is created if you can hit it in a short amount of time. So having a full face mask, because people will drop something in the water and it blasts them up. Having something cover your whole face, your forearms, and also having something for sunburn because it's on the regular is something you want to throw in here. Okay, so let's go to the next pocket. That one's open. So
they've got water treatment in here. I would probably reposition this somewhere else, but I really like that they actually include these bags roll up. This is the same type of bag you see on like the vapor.
And those are nice because they don't take a lot of weight and a lot of space. I see a lot of people that are super pro Steri-Straw. The problem with that is you got to slurp it in your mouth and spit in the bottle if you want to transport it. So if you're going to have some sort of water purification, make sure it's something that you can move from the dirty water to the clean water, and something that's lightweight, which they basically accomplished here. I'm going to add probably a Katadyn filter, some Betadine, and stuff like that. But this works. It's better than nothing, and it's interesting that they're giving you water purification in a medical kit.
Exactly, cool. Because you usually do not see that, and that's important. Along with that, they include 5 packets of. It has 2 packets of rehydrating powder, rehydrating salts is what we call them, and then 2 water treatment aqua tabs in this. So you can fill this up with dirty water, treat this water, and then also if the water has a funky flavor or things like that, you can add in this for flavor, or you can add this in for rehydration to help speed up rehydration with dehydrated victims.
A lot of people will talk about this is what you do if you're dehydrated, but rarely do kits have the equipment to actually deal with it, which is nice. So
they do have
this guy.
So this guy, so this area here is where you're going to deal with a lot of your wraps. So they've got a triangle bandage in here, and it's not the cheesecloth ones, which is nice.
Fingers,
yeah. This was kind of interesting because it's always kind of a roll of the dice with triangle bandages. The military version of triangle bandage is a cravat. Is more like a cotton bed sheet. It's green.
It's like
it's heavy duty.
Do-rag, if anything, yeah.
Yeah,
and they fall apart. Like you pull them out, and you use them, and then the threads start coming loose on them.
Yeah. So this the material that they're using for these triangle bandages is really interesting. It's kind of like it's hard to explain, but it's very thin.
Paper.
Yeah,
it's like a paper moleskin. Like I don't even know how to say that.
Exactly. So most of the triangle bandages on the civilian market are cheesecloth.
Yeah.
They're a cheesecloth, and they do work great for wrapping wounds. You can even pack wounds with them if you need to, but they don't work great in the cravat capacity of making an improvised tourniquet because they don't hold up to the windlass action when you put a windlass in there and crank it. I haven't tried this with the windlass, but what I have been impressed with is it's got stretch in one direction and then not stretch in the other. So you could do binding with this, splinting, all of that stuff, as well as wrapping wounds and things like that. But it's a really cool material. They also include a finger splint. These are like the SAM splints, which they have here as well. There's a splint that rolls out, and then it's got an aluminum
break
core.
your finger, jam it up real bad.
And when you bend it when you put a ridge in it, it becomes fully rigid.
Yeah, these are, if you've never seen one of these, they're really kind of cool, because if I make this flat, it bends just fine. If I make it U-shaped,
Turns into a
it's
splint.
super hard. Like, I don't know how to explain. Like, I really had to push to make it pop out, right? And that gives you the ability to shape it at whatever the shape of the broken bone is, and then curl it so that it creates a rigid protective thing around the broken bone. I broke my arm when I was like 14 backpacking in the Wind Rivers in Wyoming, and we had to take sticks, wrap shirts around them, and then that was the splint we used in the front and back. And you can see the scars on my arm from all the surgeries, and I had to fix it. And then we wrapped another shirt around me, and it was a solid, very well built stabilization mechanism, but it was really hot. I remember, because of the stress and the adrenaline and everything I was going through, I passed out a couple times because of the pain, and something like this would breathe. And all I can think is, man, I bet it would have been a lot nicer to have wrapped up my broken arm with this than with that thicker, heavier material.
You've got Coban, which is a self-adhering stretch wrap to go over wounds, as well as Ace Bandage, just your standard elastic bandage. This is a 3-inch, and they also include a larger size as well.
Those are cool because you don't have to use those little hooky things to make it stop. They touch each other, and they kind of work like Velcro.
Yep, exactly. Yeah, I hate dealing with those little clips.
They always get dropped out, and you're nervous and stuff. So. Okay, let's go to this next one here.
This is wound closures. They
start over real quick. Just do a pause. Okay.
All right. In this secondary area here, you've got wound closure, and they include. Here it is. They include some super glue type material, some skin safe super glue for wound closures, as well as steri strips, medi strips. These are just really thin wound closure strips that are very water.
They're like
resistant.
stitches that fit on the outside of like a Band-Aid, stitch Band-Aid. I don't know how to call
Usually
that.
see it in movies when people have cuts on their heads and stuff, and they have a couple
Hollywood
little
likes them.
thin white strips. Steri strips are awesome. They're a really good way to close a wound, and they also leave it open for breathing and for monitoring.
And there's less scarring that happens too.
Yeah,
a lot of plastic surgery will use a variation of that doesn't poke holes to put stitches in, but still holds the skin together. So
they also include blister treatment. This is the same type of stretchy Band-Aid material as on their high quality Band-Aids, but then it's got a blister pad underneath that as well, and they're very wide. They're very wide, so they cover the area fully, and especially on a heel or something where you get a lot of peel
blisters
up.
pretty regularly like this. I know when I was in boot camp, blisters were super common, and I would cut off a big old chunk of moleskin, and I would basically pop the blister, flatten it, dry it out with powder, dust the powder off, hit that moleskin on, and wear it until it fell off, and it would usually re-harden the skin, turn it into callus, and repair it because you had to keep going.
Tape. I'd like to see. Well, let's say this. So on the tape, they include 3 really good types of tape. This is a transport tape that allows breathability and stuff. Use it on IV placement and things like that. This is a good quality silk tape, and the ones that we've gotten here are Dynarex, so good brand. They're not using cheap, crappy knockoff brands. Good brand. This silk medical or EMT tape is a really good quality, so I'm impressed. I'd like to see bigger rolls. Normally, you're going to go through a lot of tape when you're working on people. It's one of the most consumable items, and so I would like to see these 2 small rolls be at least as big as this one. This is a like a waterproof.
It's got the space that can handle it. You can throw a roll of duct tape or electric tape in here if you want it.
That's another thing I was going to say. A lot of times I'll throw. You can go to a backpacking store and get a roll of duct tape that doesn't have a core in it. Mm-hmm. It's just very compact.
Like burnable duct tape.
And then I'll throw a roll of duct tape in there for utility, and then for medical. This is a lot of times you'll see a waterproof style tape. in a med kit, this is a really good one because as you saw, I can actually tear it really easy. Some of the tapes.
Yeah, they've got a
If you
string
don't have
that
scissors,
holds
it's
on
like,
and you can get it.
yeah.
Yep.
So this tears really easy, and I haven't tested this for adhesion over time yet, but in the small test that I've done last week, I was pretty impressed with this. So I'd like to see more tape, but between the transport, the silk tape, and the waterproof topper tape, I think that's
And kind of
good
overall,
setup.
we've got broken bones and cuts and
Yeah.
hiking injuries.
Yeah, and that's the thing. I would move all my wound cleaning stuff. For example, in this area here, you've got this water stuff. This is probably going to be one of the least used items. I would move this to somewhere in the pack where I don't need to get to it quickly.
Like probably the very, very back of it.
Exactly, and then pull all of my wound dressing and wound closure stuff to one area of the pack in one of these pullouts.
And like I said earlier, there's a pro medic kit and there's this medic kit. That's why there's more space available. Like, and as he was just saying, like these masks, if you need them, you need them now. I'd probably move those in
in
front.
front, yeah, with your PPE and CPR shields. Those
Yep.
need to be in the front.
And that's fine. And the
But they're
cool
good
thing about
quality.
that is now I've got a little kit that I can maybe stick an IV in or something else that needs a little more protection from the sun or whatever. And again, get a marker pen out, get a ink pen out, paint pen. Label the crap out of all this.
That would be nice if they had little Velcro placards on
Yeah.
hook and loop placards.
Let's see what's in this dude right here.
So this is where I would normally keep my tools in my responder kits. This is where I keep my tools: stethoscope, blood pressure cuff, etc.
And while we're talking about that, that was kind of the intent of some of this. Like this is for what are those little clips?
Hemostats.
Yeah, this is hemostatic holders. Like
yeah.
you
You can
don't
run your
need 'em
tools
as
here:
soon,
tweezers,
yeah.
bandage scissors, things
and you're
like
going to
that.
use it semi-regularly, so it might be a little better placement up there. But
Yep.
okay, what do we got here?
So this is kind of where they put a lot of the heavy bleed stuff. They don't have any hemostatic agents in here. That's another thing I would add. So
I definitely would add hemostatic.
Right.
I watched C-Lock stop a really bad cut that I had that I probably should have had stitched up, but didn't.
Celox is awesome. We could do a separate video on that because that is we could talk about hemostatic agents, but yeah, Celox, Quick Lock, those type of things are classified as hemostatic agents. So I would add tourniquets to this, hemostatic agents, airway control, blood pressure cuff, stethoscope. Not
Maybe
a lot.
C-spine
Yes,
stabilization.
yep, a
some
C-spine
lower-
stabilizer. That's right.
yeah.
And like Tyler said, they do make other kits that are bigger and have more stuff, or you
Yeah.
can
So
order
I'm not
more
talking
things.
smack on them. I'm saying
Yeah, it's a great kit.
just try to be truthful.
This is fantastic kit. So in here you get your different gauze and packing, wound packing and dressing components. They actually have, and again, these are Band-Aids. So this
Yeah.
to me needs to be moved to the first aid section, but and I keep all my heavy blood stopping stuff together.
And for now, I left this kit how I got it from my medic. It's great.
You're going to want to move
This is
stuff
just what
around.
we would do.
Yep, exactly.
And also in the back of here is more
should-
gauzes. Now, if you need gauze, it's usually because you're packing a wound. And if you're packing a wound, you need that right now. I think the stuff you see on a regular basis should actually be deeper in the kit. And the stuff that you need it right now to stop people from dying should be on the outside or the top.
Prioritization of survivability.
Body substance isolation, gauze, packing, tourniquets, maybe oral nasal pharyngeal. They could have a little deeper, that kind of stuff. But those things that you would see in an IFAC, you want them quick. You could also put an IFAC on the outside of this and make that your quick kit, and then just make this your mobile hospital too.
Yep, exactly. So where they put all their blood, their wound packing and blood stopping stuff is here. Now I pulled these apart and I am really impressed with the quality of the gauze pads, the trauma pads.
There's a lot of it.
And they also include non-stick, which is a big thing for me.
Yeah, you're not gonna rip you're not gonna bleed when you pull it off, right? When they get to the emergency room and they're gonna remove it and clean it, it's not gonna immediately start ripping stuff out and making the damage worse.
Yeah, we could do another video on this on how to reconfigure this, how we do it, because like I said, this is all first aid.
We'll do it later. Let's wrap up what we got.
But
What's up? Come on in. How you doing? What's up?
Not too much.
Did your little girl need her question answered real quick?
I don't know.
Okay, so let's let's wrap this up. So overall thoughts on the medic kit. Their website's mymedic.com. The kit's called the Medic Kit. The nicer kit is called the Medic Pro. And anyway, so I'm splitting it out. Overall, this is probably one of the best base model large production stomp pad or stomp bag type bags I've seen. It's not overloaded, so I can add stuff to it. I would just like James would like to rearrange some things, but okay, rearrange it. It's your bag. You do what you want. Other than that, you want a good place to start. This is a great place to start. It kind of addresses the basic needs of gunshot, vehicle accidents, backcountry, broken bones and stuff. This is kind of at a base level. I would add a few more things. Definitely need to add some more things for gunshots or trauma. Need to add a little more stabilizing things and some tools for vehicles and home type stuff. But if you are a basic level educated person or a new person, this is a great place to go. If you're a little more advanced person, either pay for the pro or add kit to it. That's kind of my thoughts on it. It's a great kit. I did buy it. I would buy it. I suggest checking it out, mymedic.com. What are your thoughts?
So my thoughts on this this kit are, first of all, I think this is a fantastic workmanship and materials.
Definitely
It's built really
robust.
well.
Yeah.
The ingredients, the quality of the components that are in this kit are probably some of the best I've seen before you start getting up into like really, really high-end stuff. You know, like Dark Angel, you know, when you get into really purpose-built stuff that's like...
A lot of that stuff's cool, but like I personally have a hard time spending on perishable items, even though I should, right? Because that stuff's really high-end and it's really top quality, but it's like you're going to use it. It's like groceries. You get good enough. Anyway, that's just my theory on that. So go ahead.
Okay, so what are my thoughts on this kit? I think that it's a great kit that can range from anything from just like family medical to like your off-grid events and stuff like that. If you do a lot of like backcountry stuff, this is going to have a lot of austere stuff as well as urban and city environments. I would add some stuff to this kit, like I'd mentioned before, but it's not a ton of stuff, and it's stuff that I would normally add to any kit on the market, so that's not unique. I really like the layout and the organization. And
you can see everything. It's nice to be like, I need that thing, and you're nervous. And like, oh, I see that thing, and I grab that thing, and I have to go digging for it. Is it in the bag? I don't know. I haven't touched it for 6 months.
Yeah, exactly. Layout and accessibility, I'm impressed with. Moreover, the key thing that I keep coming away every time I played with this kit is just the quality of the components. I can't stress enough how many times you'll spend a lot of money on a kit and thinking, oh, I've got all this stuff I spent, $500, $600 on this huge medical kit. And then you get to using it, and you start using the components, and they just don't work.
The Band-Aids are trash.
Yeah,
the stickiness is gone.
You spend all this money for stuff where you could have just bought a better container and then bought your own components if you know what you're looking for. They've done a fantastic, like 80 to 90% completion right out of the box. That to me is good.
This is a phenomenal base model. Like
yes.
I couldn't have asked for a better setup with it.
Yep. Couldn't agree more.
All right, guys. I hope that's valuable to you. This is a kit I purchased. I would buy it again. I think it's great. I'm going to add more to it. We'll do a future video on this once we've built it out. This is going to become my personal primary kit that I leave in my vehicle for when I teach, for when I drive down the highway with my family, get into accidents, go different locations, when I teach wilderness survival. It's similar to your kit, I assume, that you use for wilderness survival.
Yeah,
wilderness
you
medicine.
bring up a good point. Large group stuff.
Yes, large group stuff.
We're both instructors.
For multiple people with multiple injuries.
Right. And then, like you said earlier, when you're doing large group stuff, like we do, outside group trainings and stuff,
you may have
you blow through a lot of the basic stuff. So I like that they have. Actually, this is another thing I wanted to mention. I like that they have some of these pullouts because, like Tyler said, you could load this up with all of your day-to-day class med stuff.
That could be your hiking kit that you go hiking with and leave this in your car. Like, there's ways to do that.
You can just hook this to the front of the pack, and now when you're out,
you can take in my case, I've got a lot of molly crap. I've been a soldier for a long time. I can grab kits that I've already got, IFAKs that I've already got, purpose-built stuff like those. When I was in Afghanistan, we used a Lord kit. And it's this little kit that sits in the middle of your backpack, and it's like the absolute basics of body substance isolation, sucking chest wound, maybe some like Ranger candy, ibuprofen, and tourniquet, right? I can put one or two of those on it and say, all right, I'm going to go hiking. I don't want to carry this big beast. Pull that off, put it in my pocket, and go. So that modularity is phenomenal, building things in layers. This is the mobile hospital, this is the mobile EMT, and the other thing is like a personal thing. I can pop it off and send it and go.
Yeah, staying organized is really important when you're talking about medical stuff, because when you need things, you need to be able to access them quickly. So accessibility. and a speed of accessibility and organization, so mentally you know where things are at and you can grab them.
Got to get to it quick.
The other component that that plays into is if you direct somebody else to grab and use your kit.
Yeah,
Those
open the
labelings
second
and
pouch,
stuff.
it's going to say blood.
Yeah, you don't want them to be like digging around trying to find
And then
stuff.
they bring you something and it's the wrong something.
Yeah, so get your stuff labeled.
Yep. Cool.
Excellent.
If you're interested in this, go to mymedic.com. They have these kits. It's called The Medic. If you want to get the high-end one, it's called the Medic Pro. I have their IFAC kit. I love that as well. Everything I've seen from them is quality.
You have different colorways and stuff too, right?
Yeah, I like tan. Tan's cool.
Me too.
All right, guys. Thank you for watching.